Hey guys, this is Dr. Frank Gardiner, and today I want to talk about TMJ disorders or temporal mandibular joint disorders. To be able to explain TMJ disorders, we have to know normal function and anatomy of TMJ. In general, the lower jaw in dentistry is called mandible. Upper jaw is called maxilla. TMJ includes from bony projection of mandible, which is called condyle, bony depression of maxilla, which is called glenoid fossa, and cartilage in between, which is called articular disc. In normal function of TMJ, articular disc moves with condyle smooth and effortlessly. In disk displacement, when jaw opens, articular disc doesn't remain in the right place during the movement. Instead of push in front of the condyle. Disk displacement with reduction means articular disc pops back to the right place during the movement. Disk displacement without reduction means articular disc does not pop back to the right place during the movement at all. One of the most important reasons for disk displacement is grinding and clenching habit, which is part of functional habit and destructive and can destroy your teeth. This happens mostly because of contraction and tensity of masticatory muscles, most importantly, masseter and temporalis. What are the symptoms of grinding or clenching which can cause this displacement? Any type of the muscle tensions can cause actually grinding and clenching habit. That's why we can have any type of the muscle spasm, kind of like a pain, jaw pain, toothache, any type of migrainous pain can be part of the symptoms. With disk displacement with reduction, because articular disc pops back to the right place, we have clicking and popping. In disk displacement without reduction, because articular disc does not pop back to the right place at all, sometimes we have a lockjaw. Let's see what are the reasons for grinding and clenching habits. One of the most important reasons is stress or any emotional reasons. Second is medication. Any type of antidepressant or anti-anxiety medication can cause grinding or clenching habit. Third is malocclusion or any misalignment of teeth or jaw. Another reason is lifestyle. Drinking too much caffeine and alcohol can cause grinding and clenching habit. Let's just see how we're gonna manage and treat disk displacement due to grinding or clenching habit. As I mentioned, grinding and clenching habit happens mostly because of muscle tension of masticatory muscles, mostly masseter and temporalis. We have to relax this muscle somehow. One of the most important and common treatment for the grinding and clenching habit is occlusal guard or night guard. We fabricate something like this, night guard or occlusal guard, and then you have to wear this before you go to sleep or anytime you catch yourself clenching. This is gonna stretch your muscles and is gonna relax your masticatory muscles. Second is the medications. Basically, muscle relaxants, especially Robaxin, is going to take care of the damaged muscles and is gonna make your muscle relax. Third is the Botox. With the direct injection of Botox in masticatory muscles, we're going to make them relax. In general, Botox is a treatment of choice of migrainous pain, orofacial pain, and TMJ. Thank you for watching this video. Please like and share this video and subscribe my channel. Please ask your question in the comments. That way I can make videos and answer your questions. See you around.